Welcome, everyone. This is Virginia Parsons, your Hangout mentor, and I'm here today to interview Dr. Tammy Krukowski, who is a chiropractic neurologist who works with individuals who have typical chiropractic issues, headaches, neck pain, back pain, you know those feelings. But she also works with people who have conditions that are much more complex, anything from cerebral palsy, MS, Parkinson's, stroke, ADD, ADHD, and lots of other mental health issues. Now, she is one of about a dozen chiropractors in Wisconsin who has completed the additional training to become a chiropractic neurologist. So welcome, Dr. Tammy. It's great to have you here. Come say hello to the audience.
Hello, everybody.
We love having you here because I think it's important that people understand what you do, and it is quite distinct. So tell us, Dr. Tammy, what do all of those letters mean behind your name? And I understand there's a few more that we can't see.
Yeah, so the DC, in Wisconsin, we have to legally specify what type of doctor we are, and we do that with the letters behind the name. So the DC is just Doctor of Chiropractic. DIBCN, which you can see, is the diplomate from the International Board of Chiropractic Neurology. Just says that, yeah, I did all these crazy neurology courses and I passed the board exam. And then the ones that you can't see are CCEP, which means Certified Chiropractic Extremity Practitioner. Just means that I've done extra training in treating shoulders, ankles, knees, hips, TMJ stuff. So a lot of random letters. Alphabet soup.
Well, it's nice to know you've had that extra training, because that means that you're the type of doctor who goes beyond the norm, who really wants to learn and then have that extra skill set in working with your patients. So I think that's really a great thing to know. Now, how about the neurology part of this? Now, I understand you have a little background and as to why you decided to emphasize this in your practice. Would you like to share that with our viewers?
Absolutely. So in chiropractic school, we learn how to adjust people and come up with care plans and how to treat everyone. But when I was going through school about halfway through, I actually found out 2 of my cousins had developed autism. So I was asking teachers at the school, well, what can I do as a chiropractor to help this condition? And they're like, well, just adjust them. And I'm like, well, what about the adjustment helps, these individuals? And nobody could really explain it. And after I graduated and I opened up my office, I found this gentleman who treats all these crazy conditions that I work with. He's become my mentor and everything like that. Just an amazing guy, and he taught me what I needed to know, how it can work, and how you can work with some of these special populations. So really cool.
When you're talking about the neurological aspects of treatment, it sounds like you're working with people then who have autism as one. What are some of the other conditions that you're working with from a neurological standpoint?
So some of the other things that I'm working with in the office, in addition to that, we have individuals who've had strokes, so we're doing special rehab with them, along with adjusting them to help maintain the gains that they've made. We've got individuals with learning disorders, dyslexia. We've had individuals with attention deficit and ADD, ADHD stuff. Parkinson's. I've had a couple individuals with Parkinson's, MS, like you name it. Some of the more, I guess, out there conditions most chiropractors would probably shy away from. Respond really well.
So I think that's interesting. What can someone with those kind of conditions expect? I mean, treatment-wise versus traditional chiropractic.
So one of the big things in my office is we look at breathing efficiency when we're adjusting somebody. So ideally, when a person's laying on their stomach, you're going to see their butt hopefully be the first thing that moves when they take a breath in, and then it should be a nice wave up the back as they inhale, and then as they exhale, it should go starting from the neck or shoulders down back to the butt again and start all over. A lot of times, though, that's not the breathing pattern we see. It's inefficient, and it wastes a lot of energy because your brain's all about trying to keep you alive, and breathing's pretty high up on that scale of keeping you up and going. So we make that efficient. It frees up some energy so that stuff can then go and do other things in the body, like heal, take care of pain, and what have you.
So in those instances, it sounds like you're starting with the breathing pattern and diagnosis first before anything else?
Yeah, for the most part. I mean, we'll do a comprehensive exam when a person comes in here, get to know what kind of concerns that they've got, any issues, things like that, do a history, and then, yeah, when we do go to the adjusting, that's specifically what we're looking for, is making the body efficient that way.
Very interesting. I'm just curious about something like Parkinson's. So that's a disorder, a neurological disorder that causes the body to shake. Is that correct?
Yeah, and so, yeah, most people.
Yeah, and so what kind of results can people expect with treatment for Parkinson's? Because I know the only thing I've heard of for Parkinson's is drug therapy.
So one of the things is teaching them new activities to learn. One of the cases I was working on this past year was a woman, I'm trying to think, she was probably in her 70s or so, had started developing it. She was on meds and they weren't really working well for her. But the biggest thing is learning new tasks, keeping the brain active, because just like our spines, we're designed to move and the brain's designed to learn and do things. But by learning new tasks and not becoming so rigid in a pattern, you can actually start making increased dopamine, and then that will help.
So you're going to be doing a treatment on them that is going to help balance neurologically, and then you're also going to be giving them some form of activity, a recommendation.
Yeah, for this particular woman, she was really into crocheting, so I didn't want her to do that because she knew how to do it, so it's repetitive motion for her. So learning something new, so we had her tying fishing lines, making different knots, and just doing random things like that, learning to dance. For the guys, yeah, you might have to crochet or you might have to learn how to knit or something else, but get something new that you've never done before, and that'll be really beneficial.
Okay, that's fascinating. I think that's really interesting. So let's go into generally what is unique about traditional chiropractic treatment versus traditional medical treatment when you go to another kind of doctor.
So chiropractors are really unique in the fact that we're looking to get to the root of the problem, and in our world we call it a subluxation. So we're basically looking to correct the subluxation in the spine. It could be, and sometimes it's elsewhere, it could be extremities or what have you, but remove that so that your brain can talk to your body and send the signals the way it should. That way your body can heal itself. Typically most medical doctors are going to want to give you medication or do something else to either mask the symptoms or just get you out of pain that way, but you're not really dealing with the cause, and that's what chiropractors do.
Well, I think that makes sense long term. If someone wants to really heal structurally, that they need to get to the root cause rather than mask it with pain medication or a muscle relaxant. That makes sense to me anyway. So why would you say that it is advisable for everyone to have regular chiropractic adjustments?
We're using our spines every day. Our nervous system's working every single moment of every single day. It's controlling everything we do, from breathing, heart rate, gut digestion, hormone levels, blood, serum level, like everything you can think of and can't think of that your body's doing without you worrying about it is controlled by the nervous system. So by getting adjusted on a regular basis can help make sure that your brain can actually do those functions and control all that stuff.
Well, I think that's fascinating. Dr. Tammy, is there anything else you'd like for people, our viewers, to know that's really, significantly special about the work that you do?
For the most part, yeah. It's really cool to see people just responding to care the way they do. If you've been afraid to try a chiropractor or have heard bad things, like anything else, go get a different opinion, try somebody else. Not everybody's gonna mesh well with me as a patient, and I might not be the doctor for everybody, and I'm okay with that. But there's plenty of other chiropractors in the area that I can either refer to, and people should try for themselves. But it's truly amazing, and I know I personally have benefited from it tremendously. Just that's actually how I got into it, was personal experience with chiropractic. So.
Well, that's not unusual that, you went into the neurological aspect of it because of personal experience in your family, and then having results for it yourself, that it's something that is of real value. So I'd like to encourage you all to look into Dr. Tammy and her work, and we thank you so much for being here on the show today, and thank you everyone for viewing. Dr. Tammy, thank you so much. You can say goodbye to everyone now.
Thank you for having me.
It's been great. Bye-bye now.